These are the components when doing the cardiac portion of a head-to-toe assessment. First, auscultate or listen to the heart sounds and the apical pulse. Palpate and feel the pulses bilaterally down the body, and then you want to assess the extremities for capillary refill, edema, hair distribution, color, temperature, etc.
Auscultating heart sounds the 4 valves. So this is the name of the valves and also the location. So the first one is the aortic valve. It's in the second intercostal space right of the sternal border. Next is the pulmonic valve in the second intercostal space left of the sternal border. Next is the tricuspid valve, 5th intercostal space left of the sternal border. And last is the mitral valve, 5th intercostal space mid-clavicular line. This is also where you listen to the apical pulse, and you'll listen for 1 full minute.
If you have trouble remembering the names of the valves, you can use the mnemonic all people take money. A for aortic, all. P for pulmonic, people. T for tricuspid, take. And M for mitral, money.
Part of your cardiac assessment is assessing pulses. The pulses that we will be assessing for is carotid, brachial, radial, femoral, popliteal, posterior tibial, and dorsalis pedis.
The carotid pulse is located beneath the jaw, and you want to palpate these one at a time. If you palpate both, you may restrict blood flow to the brain, and that could cause someone to lose consciousness. So one at a time, you place 2 fingers directly below the corner of your jaw.
For the brachial pulse, you will palpate these bilaterally, and they're located on the pinky side of the inside of the elbow.
The radial pulse is in the wrist, and it is on the thumb side, on the underside of the wrist. You could feel these bilaterally on both at the same time.
For the femoral pulse, first you want to ask the patient's permission. You also will palpate these bilaterally, and they're in the hip crease of the patient.
The popliteal pulse is located behind the knee. You generally have to push with some pressure and avoid tendons to find this pulse. It can be very difficult to find.
The posterior tibial pulse is behind the ankle bone on the inside of the foot. Another way to remember it is it's behind the walnut.
Lastly, the dorsalis pedis pulse is on the top of the foot. If you take 2 fingers and place it between the big toe and the second toe and slide down the foot towards the ankle, you'll find it. You want to palpate these bilaterally as well. A way to remember it is to think of baby shark. What we mean by that is think dorsalis sounds like dorsal fin, and where you're placing your fingers is where the dorsal fin would be on a shark, the back. Pedis kind of sounds like peds, which is kids or babies, so think baby shark.